Welcome to Docs on Call, brought to you by Fort Wayne Endocrinology.
Good evening, good to see you again. I'm Lee Kelso. Tonight on the program, we're going to focus on hormone replacement therapy. And we might just challenge some of the common wisdom about a potential connection between HRT and cancer. It has to do not just with the hormones, but what type of hormones are used. And we'll get into that in just a second. Our guest tonight is Dr. Ashok Kadambi from Fort Wayne Endocrinology. Good to see you again.
Good evening, Lee. Nice to have you back.
Let me set the stage for you. So for many, many years, hormone replacement therapy was used as a treatment to relieve the symptoms of menopause, the night sweats, hot flashes, and other issues that many women suffer in menopause. But then something changed all that to cause a different way of thinking. What was that?
What was that was a study called WHI, Women's Health Initiative study, that basically compared the risk of cancer and other bad things happening to you with and without hormone therapy. And they concluded that, they didn't conclude, but the news media and the medical establishment concluded that all hormones were bad and they were to be used only for a short period of time in the smallest possible dose just for symptom relief. And as a result, there was a lot of confusion and chaos in the medical community and also among patients what to do with their hormone therapies.
So what we have since learned is it wasn't the hormones themselves, but it is the type of hormone being used, right?
Absolutely the type of hormone that was being used. And not all hormones are created equal. If they were to use the right kind of, had they used the right kind of hormones, then they wouldn't have had these problems.
And the right kind of hormones is something called a bioidentical hormone as opposed to a synthetic hormone. Now explain that difference for me.
Yeah, the difference is a bioidentical hormone is an exact replica of the hormone that you produce, that the human produces naturally. A synthetic or a non-bioidentical hormone is a hormone that has been altered for various reasons. And if you use the altered hormone, you're not going to get the same results as if you had used like the bioidentical hormone.
We can actually illustrate that by showing you just exactly the difference between those two hormones on a molecular level, believe it or not. So tell us what we're looking at here on the left and the right there at the top of the screen.
This is a rendition, artist's rendition of what a progesterone molecule and what a Provera, which is the synthetic counterpart, looks like. On the left-hand side of your screen, you see progesterone, and on the right-hand side, you see Provera, which is the synthetic or the biologically different hormone. By the way, Provera is the one that was used in the Women's Health Initiative study. If you just look at it on cursory glance, it looks like they're the same thing. But actually, if you look at it in detail, on the right-hand side, you see differences in the side chain. It's these side chain differences that make a difference in the in the actions of this hormone. In fact, progesterone and Provera have exactly the opposite effect. Progesterone is progestational; it promotes pregnancy. Provera causes birth defects. Okay, and yet, physicians and doctors use the term progesterone and Provera interchangeably, and wrongly so, because they're entirely different molecules. In fact, they're not even. I wish they didn't sound alike. You know, they were the real name for progesterone or Provera is medroxyprogesterone acetate, because it's a long name. They don't say that, so they call it Provera for short. So progesterone and Provera are two different hormones. One's bioidentical, one's natural, one's got good effects. The other one is biologically different. It's biologically altered, and it's got way too many side effects.
Excellent. So I think that sets the stage for us. What you like to do is see patients come to a therapeutic level in their treatment, right? So you want to give enough of the bioidentical hormone so that it solves the problem we're trying to address and not just meet a minimum level.
Exactly right. We, in our practice, we aim for therapeutic levels. In other words, levels that make a difference in their bone densities and cardiovascular risk, and also reduction risk of Alzheimer's. So for that, we normally shoot for around 10 to 20 nanograms per micrograms per DL for progesterone. Estradiol, I like to keep the levels between 60 and 200. But these are all different, you know, I'm getting very ahead of myself, more technical here. But basically, the point I'm trying to emphasize is when you're giving these hormones, don't just give it and see them next year. You need to monitor the levels.
Excellent. I think that's a key difference. We're going to take a look at the next slide for you here and explain some of the differences. And it drives home the point again that it's not that all hormones are bad, it's exactly the type of hormone that you're given, right?
Exactly true. It's the type makes all the difference. And progesterone should not be blamed for all the wrongdoings of progestins such as Provera.
And beyond that, there are a number of studies now that indicate it's not a lack of hormones, or rather it is a lack of hormones that is at risk, right? It creates the risk.
Correct. There's a growing consensus now, although it's a minority view, that actually hormone deficiency can induce cancer. This is probably true in prostate cancer in males, where actually testosterone deficiency can cause people with testosterone deficiency have some of the worst or most aggressive type of prostate cancer.
So again, don't allow the one study to have colored our entire thinking about this. Since then, there have been a number of studies that indicate hormones, the right type of hormones, are actually preventative and beneficial, and that long-term use can be safe if monitored at therapeutic levels.
Absolutely. One study doesn't negate 50 other studies that were positive.
Right. So, and are physicians coming around? Are people catching on to this change?
Lee, I'm very blessed to be in a community among, where most of the physicians are very forward-thinking and positive, and they're open to new ideas. And I found that very refreshing practicing medicine here in this community. More and more physicians are seeing things the way I saw it 10 years ago. And it's a minority nevertheless, but it's a growing minority of physicians that are actually leading the charge, so to speak, on optimal hormone replacement therapy.
So if you're just joining us, we're talking tonight with Dr. Ashok Kadambi from Fort Wayne Endocrinology. We're going to open the phones at 483-8331 if you have questions about what's happening in your world, treatment that you might be seeking for some help with a variety of symptoms, menopausal symptoms being some of the most foremost. And we're welcoming your calls at 483-8331. So walk me through this process. I come to you for treatment. Where are you going to start? What's the first thing that happens?
First thing that happens is we take a detailed history and examination, and then we do some blood tests. And we determine where your baseline hormonal status is. And based on that, when you come back for the return visit, we formulate a game plan, a treatment plan for you, individualized for your needs. Okay?
And then you develop a prescription for this bioidentical hormone. How is it applied typically?
Yeah, there are different ways to give the bioidentical hormone. Either we can give it through the skin, or we can give it orally, or we can give it sublingually under the tongue. It all depends on your absorption, characteristics. Some people absorb better sublingually, some people absorb it better orally, and for some, the skin is very convenient. So it's got to be individualized.
And is it difficult to find these prescriptions? Am I sending off to some pharmacy across the world?
Well, it's not. You can't ask a standard pharmacy to prepare this for you. You have to go to a compounding pharmacy. And over the years, we've been working with several compounding pharmacies, both in the area and out of state. And my office will be happy to provide a list of those pharmacies.
So give me an idea of how soon patients start to respond to the treatment.
The first thing that happens, Lee, is women come and tell me that they sleep so much better. This happens in days. It doesn't have to take months for this.
Wow.
Okay. So I would say the response to treatment happens virtually immediately.
And then how long is it a period of adjustment till you're getting to that therapeutic level, a couple of cycles and tests, or you do?
Right. Initially, we see our patients more frequently, maybe every 6 weeks or so, and then later on we see them once or twice a year, once they're stable.
And there's no issue with me taking these prescriptions for a long period of time?
Well, I've been doing this now for 15 years, and I have patients on it now for 15 years. Many of them don't want to stop it because they feel great on it.
So what other benefits are you seeing? So they sleep better with the hot flashes, the night sweats are gone?
Yes, there are two things to look at. One is the feel-good effects. Okay, that is symptom relief. The other one is the long-term health benefits, which is prevention of osteoporosis, prevention of heart disease, prevention of Alzheimer's, and prevention of basically muscle loss or frailty, we call that.
Oh, goodness. Sounds like so many benefits there. Let's get to the phones, and Paula is our first caller tonight. What's your question for Dr. Kadambi, Paula?
Paula?
Hello?
Yeah, go ahead.
I can hear you loud and clear.
Hi, I'm sorry.
That's all right.
Yeah.
My mother took hormones for 30 years, and she always believed that you need to take them together, and meaning progesterone and
Estrogen, probably.
you know,
right?
you can't just take one or the other.
Correct.
She believed that that's how you would get cancer.
That's
So
absolutely
is
correct.
that true, you believe?
100% true. In
Okay.
fact, progesterone is given to oppose the effect of unopposed estrogen. So if you gave progesterone with estrogen, you negate some of the side effects of estrogen. One of the side effects of estrogen, estrogen is a very good thing, don't get me wrong, but what happens sometimes is if you have estrogen only and not opposed by progesterone, that puts you at an increased risk for breast cancer, because estrogen causes proliferation of multiplication of the breast tissue, whereas progesterone just does the opposite. It calms it down. So you need something to balance that. And when you add progesterone to estrogen, it offers you a nice balance, and it prevents the breast cancer. It prevents the risk of breast cancer. In fact, it reduces the risk of breast cancer.
There you go, Paula. Your mom was correct. Let me follow up on that, though. So if I've had breast cancer or there's been breast cancer in my family, are bioidenticals a safe option for me?
Why don't we go to slide number 8? I think I can illustrate that with that. But basically what it is I often get asked this question, you know, doc, my family history of I got a family history of breast cancer. Can I take hormones? The answer is you should take hormones, because hormones actually protect you against breast cancer, the right balance, the right kind. Mm-hmm. And there is a study done on something called the BRCA gene, okay? Let's go to slide number 9. The BRCA1 mutation is basically a condition where you're at higher risk of breast cancer, and it's familial. And in these cases, the hormone therapy used was not associated with an increased risk of breast cancer. And actually, to the contrary, to their surprise, it lowered the risk of breast cancer. So the very thing that you fear is the very thing that you needed.
How about that? Again, if it's bioidentical.
If it's bioidentical.
Right. Boy, the phones are filled, so let's jump back out to the phones. Nancy, you're up next on our program. Go right ahead with your question for Dr. Kadambi.
Hi. My question is about estradiol.
Mm-hmm.
You can give me your opinion about that.
Yes. Nancy, estradiol is the most natural occurring estrogen in women. Okay? And that's the kind of estrogen that I would always recommend. And it's actually, if you want to be technical, it's 17 beta estradiol. So when I talk about estrogen, I mean 17 beta estradiol or estradiol, okay? And that's the only estrogen I would really consider using in women.
Wonderful. What about long term?
Yeah, the long-term estradiol has some very, very interesting properties. It's an antioxidant, number one, okay? And there are some studies that show that it's actually also an antiviral. So if you're well replaced with estrogen, you may be likely, if you get the flu, you're likely to have a shorter duration of the flu. So it can actually protect you in that sense. But it is an antioxidant. It can reverse heart disease. In fact, estradiol is one of two hormones that have been shown to reverse plaque. The other is growth hormone.
Wow.
Has been clinically shown in clinical studies to actually reverse atherosclerotic heart disease. So estradiol is the one to go for, okay, if you're talking about estrogen replacement therapy. It's not Premarin, it's not from horses, it's natural estradiol.
Thank you,
Okay,
Nancy.
that's what I wanted to know. Thank you.
You bet.
You know, I think you just made an important point, and that is that you might hear of natural hormones, but natural and bioidentical are not one and the same, right?
Correct. For example, Premarin may be considered...
Just a second, let me help you here. I have to do a little microphone surgery. If you'll just be with us for a second. Dr. Kadambi's microphone slipped down, so
All right.
it's here somewhere. That's right. Live television, things happen sometimes. There we go.
There it is. Okay.
There you
That's
go.
perfect.
Live surgery there, a little television surgery for you. So again, the issue here being that things that are promoted as natural are not one and the same with bioidentical. Walk that through for just a second.
Yes. Well, let's take Premarin. Okay, Premarin, some people may think it's natural because it's coming from a natural source, which is the urine of a pregnant horse or pregnant mare. It may be natural for the pregnant mare, but it certainly ain't natural for the human being.
Right.
So when I talk about natural hormone, natural estrogen in humans, it's 17 beta estradiol, the kind that Nancy earlier alluded to. Okay, that's the one we want.
Very good. Shannon, you've been on the line for a little while. Let's go ahead with your question.
Yes, hi. I am a former patient of the doctor's, actually, many, many, many years ago, about 10, 12 years ago.
Former
And I
patient,
have,
that doesn't sound very well. That's not very nice.
Oh, well,
Okay, all right.
no, it's just that I moved and
All right.
so on and so forth.
All right.
But anyway, I'm hypothyroid, and I'm just now at 3 months without a cycle, so I feel I'm starting menopause. So I'm just wondering if there's some things that I should be considering or looking out for.
Let me stop you and make clear to the audience, hypothyroid means low thyroid output.
Right.
Yes, sir.
So you're hypothyroid, now you're menopausal, basically.
Yes.
So are you symptomatic? Do you have a lot of sleep cycle problems? You have difficulty falling asleep, staying asleep?
Well, actually, it's ironic that you should ask that, because just in the past couple of weeks I've been waking up in the middle of the night, which is not my norm at all. However, I also had a close family member pass away recently, so I don't know what it's related to.
Well, I think you'll greatly benefit with hormone replacement therapy. First of all, a blood test will tell us where you're deficient, whether it's mostly estrogen or estrogen progesterone or only progesterone. Earlier on, in the early phases of menopause, I always first replace the progesterone first, and then I add layer the estrogen on later. The reason for that is a lot of women who've not had a hysterectomy, for example, they may bleed if I give them estrogens. So we always prime them with progesterone first. But this is just something that, a little trick of the trade that we learned in the clinic to do. And the very first thing that women report when they go on hormone therapy or bioidentical hormone therapy is that they sleep so much better. They wake up so refreshed. In fact, a lot of the chronic fatigue gets better because these women are fatigued because they're not sleeping well. So the energy level goes up as well. So that's one of the earliest things that you see with hormone therapy, and that's why it's so gratifying to treat these patients, because they respond early and they respond very well.
There you are, Shannon. Wish you all the best. Gail, thank you for being on hold for so long. Let's get your question on the air with Dr. Kadambi. Go right ahead.
Yes, if I'm 73, would it be beneficial for me to take a hormone therapy?
Right. Are you a 73 going on 90, or you're 73 going on 50?
Like that question.
73 going on 50.
Okay,
And
so you're active.
I've taken estrogen for a long time.
Okay. All right. And why did you stop it?
Because there was a lot of talk about taking Premarin. So
Okay.
I stopped.
So you stopped. You were on Premarin, so you stopped. You probably weren't taking Provera, right? Because you had a hysterectomy in the past, I presume?
Yes, I've had a hysterectomy.
Okay. There's absolutely no reason on earth why you shouldn't be on 17-beta estradiol and a little bit of bioidentical progesterone. Okay. If you want to protect yourself against heart disease, against Alzheimer's, against bone loss, you need to be on it. If you don't want this kind of protection, then don't be on it.
Well, I've had a stroke. I have AFib. Would it benefit me now?
Well, it'll benefit you now in the sense that you can't reverse what's already happened, but you can prevent further damage.
Okay.
Okay, and then remember this, estradiol is one of the few hormones that have actually been shown in clinical studies to reverse plaque. So it may actually be really beneficial for you.
Yes, it could.
Okay. All right. Thank you very much.
Thank you, Gail.
Thank you,
All
Gail.
right. Bye.
Alona, you are next on the program. Let's get your question on the air. Go right ahead.
Yep.
Alana, are you there?
Yes. Is it safe to take estrogen if you have pituitary problems?
Is it safe to take estrogen if you have pituitary problems? Pituitary problems are very different from menopause. I mean, they're totally different organ systems. Yes, the short answer is yes, but the long answer is it depends. I would look at all the other pituitary hormones also, okay, in addition to giving you estrogen. Yeah, can you hear me now?
Yes, I can hear you.
Yeah, I would replace not just the estrogen and progesterone, but also your pituitary hormones if those are found to be deficient.
Okay.
Alana, we're going to move along, Alana. We have some other callers we want to get to before the program wraps up. Mary, you're next on the program. Go right ahead.
Hi, Dr. Kandabi.
Hi.
Hi. I am a patient of yours. I have been taking estradiol, testosterone, progesterone, thyroid, and DHEA.
Okay.
I just wanted to let you know how wonderful I feel
Oh, great.
taking your products.
All right. Glad to know that.
And could you maybe tell people a little bit about the DHEA?
DHEA, okay. DHEA is what we call an adrenal prohormone or precursor. It's possibly the most abundant hormone in the human body. Okay, it's made by the adrenal glands, and what it does for you is it boosts the immune system. It serves as raw material for other hormone manufacturing. Okay, and it helps libido in a lot of women. So I always look at the DHEA levels, and if they are low, I try to replace them. DHEA has now actually been approved in large doses for people with lupus. FDA has approved DHEA treatment, high doses for treatment of lupus. But it has far-reaching immune beneficial effects. It actually bolsters the immune system, makes it stronger.
Mary, let me ask you, you said you feel so much better. Can you give me some more description behind that? How do you feel differently?
Okay, like the DHEA, it helps with your memory.
Okay.
Wonderful.
Like, where's my keys? I can't find my keys, and then you go out, you can't find your car. It helps your memory. Also, I had a hysterectomy a few years back, and I was given the little green pill. That little green pill just scared me real bad because it's something that you can get cancer from. It did not help at all with my hot flashes, and I had to go back and see Dr. Kandabi. I'm fine. I no longer have hot flashes. My father also started seeing Dr. Kandabi when he was 75 years old. Now, my father has passed, but he dropped 45 pounds, started taking testosterone, and he felt wonderful. He felt like he could lift and, do things that he hasn't done since he's been 30.
Oh, very nice.
So
Nice to hear.
I'm telling you, this.
It's very gratifying to hear that he had a good quality of life towards the end of his life.
Absolutely. And we'll do a program in the future with Dr. Kanambi focused on testosterone and hormone issues for men. So guys, we're not going to forget about you. But Mary, thank you for your call. We're going to roll ahead to Sarah. We just heard Mary mention some memory issues. Are you having some brain fog, memory issues? Is that what I understand, Sarah?
Absolutely.
Tell me more about that.
Well, I wanted to see if hormone replacement therapy would be a viable option. I have fibromyalgia and have been in menopause for several years. And brain fog and just short-term memory kinds of things is what seems to be getting increasingly worse, whereas the night sweats and sleeping seems to be subsiding a little bit.
Okay. Well, Sarah, looks like what you need is a full comprehensive hormonal workup, because the brain fog can result from a lack of different hormones, including human growth hormone, DHEA, thyroid, for example, okay, and not just the estrogen and progesterone. So you need a comprehensive workup looking at all your hormones, and we need to optimize them. That's what we need.
Okay.
To
do. Okay.
All right, good.
That sounds great.
Sarah will have the number for the practice on the screen at the end of the program. You can call and check on an evaluation then. Michelle has a question for us about natural hormones. Michelle, you're on the program. Go ahead.
Yes, I would like to know if you have anything natural that you would recommend for hot flashes. Pretty much night sweats is what I get. I approximately get maybe 2-3 hours of sleep, and then the rest of the time it's all interrupted. I cannot sleep. I'm hot, and I just cannot get comfortable, which then makes me tired throughout the day. I have tried the black cohosh, but that was unsuccessful. I have not had a hysterectomy, and I have had a bone density test done in August, and it was good.
Okay. Well, it looks like you have significant symptoms from hormone deficiency. I would definitely go and have your hormone levels assessed and put you on something called 17-beta estradiol or estradiol and progesterone both, because you do have a uterus. So that would be the bioidentical or natural hormones I would recommend. Nothing over the counter is going to help you at this point.
And again, the point of, we touched on it earlier, Michelle, a natural hormone is not the same as a bioidentical hormone. So if you are speaking to someone about that, be careful about those words. They're not interchangeable at all. Thank you for your call, though. Teresa, you're up next on our program. Go ahead.
Hi, Teresa.
Hi.
Yeah, I've been on estradiol since I was 27. I'm 50 now. Do I have to stay on it the rest of my life?
The short answer is yes. The long answer is it depends. Okay, it depends on a lot of factors. What are your risk factors, family history, whether you want to prevent osteoporosis, whether you want to prevent Alzheimer's. I do think you need to remain on it indefinitely, but perhaps not at the same heavy dose as you were when you were 27. So, hope that answers your question.
So again, the process there is an evaluation to make sure she's at therapeutic levels.
Right.
And
My
all
guess
within
is that she
balance?
had a hysterectomy, and that's the reason why she's on estrogen only.
Yeah.
And she also needs to balance it with progesterone to prevent breast cancer risk.
Right.
So, yes, you do.
Let's see, Tammy, you're on the program. Go right ahead. Dr. Kadambi is on the line with you.
Hello, Dr. Kadambi.
Hi, Tammy.
Hi. I am a current patient of Dr. Kadambi's and have been coming to see you for about 4 to 5 years. And I just wanted to say that he completely changed my life. I was in my late 40s, just having a really tough time dealing with just life in general, angry all the time, always edgy, and had a long talk with him, and he did a full workup and told me to come back in 3 months and ask my husband if anything had changed. And so I asked him the night before, I said, I'm supposed to ask you if you noticed a difference, and he said, like night and day. He said, I have my old Tammy back.
Yeah.
You know, you're happy again, and it's just, I wouldn't miss an appointment for anything.
Tammy, we're so short on time. Thank you very much.
I get a lot of Christmas cards from happy husbands.
I bet
Thank you,
you
Tammy,
do.
for the endorsement.
Thank you.
I don't think we've had a program with as many satisfied patients calling as we've had tonight. I think
Yeah, that's
that
amazing.
says a lot. Yeah, it's very nice. So thank you very much for joining us. If you'd like to get in touch with Dr. Kadambi, you may reach him at Fort Wayne Endocrinology. The phone number is on your screen, 436-1248, or you can visit the website ftwendo.com. Guest tonight was Dr. Ashok Kadambi. Next week on the program, Dr. Luga Kangira from Fort Wayne Oral and Maxillofacial Surgery and Implant Center will be here. We're going to be talking about corrective jaw surgery and dental implants. And I'll remind you, you can watch this program anytime you like. Just log on to 20minutelive.com, go to the features page, click on Docs on Call. If you saw something here tonight you'd like to share with a friend, you can send them that link and they too can learn about the effects of bioidentical hormone therapy. Thank you so much for joining us. We'll see you next Wednesday night. Take care.